So I'll say in 2017, there was a weekend-long conference in Chicago that was sponsored by the Chicago Center for Psychoanalysis. And it was a very interesting conference in that it was multidisciplinary. There were therapists there, of course. There was also a state senator there from the state of Illinois. There was a former lobbyist for the insurance industry who had a lot to say. So was really bringing together a lot of different viewpoints into the system of mental health care. And as a result, a lot of the therapists, mostly therapists in the audience who attended, were enlightened, illuminated, frustrated, angry, itching to do something. And coming out of that conference, people were just asked to write their names and email addresses on a piece of paper. And from there, that was really the birth of Psychotherapy Action Network. And we have started from that time in January 2017 till now, June 2025. We have grown that list of names to over 6,000 individuals and over 90 organizations that have joined us. And really, we are driven by a focus on supporting, advocating for effective psychotherapies that create lasting and meaningful change for people, centered on the principles of the relationship, of helping patients develop insight into an awareness and depth, going beneath that symptom level, that diagnostic label, but really helping people understand themselves. And those we see are really the fundamental elements of therapy. And we have brought together therapists from all different theoretical disciplines. And, really on this one size does not fit all kind of approach that so many of these big systems really want to force everyone into, a label and into a small box. And I think we've been successful in trying to support therapists, trying also to advocate with policymakers so that they better understand some of the trade-offs they're making when they're weighing funding and insurance issues and things like that. And then also, importantly, the public. The public they're the ones we're trying to help, and they desperately want and need help, and they desperately want and need reliable, trustworthy information about where they can find help and what they should do. And we've done a lot of direct research with the public to understand that, and maybe we'll talk about some of that later. But the public really wants what quality therapists have to offer. And they're as frustrated with the system as we are. And what we're trying to do is also build tools and databases and information and videos and articles, et cetera, to help educate and empower the public so that, also lift them up in a grassroots way so they can more compellingly demand the care that they want.